Injury to the cartilage that lines the surface of our joints can occur with jarring mechanisms or any injury that compromises the stability of a joint. This cartilage is known as articular hyaline cartilage, and it's a very unique tissue. You'll know this sort of tissue if you've ever looked at the glossy end of a chicken drumstick. It's smooth, and it also provides shock absorption. It's not to be confused with fibrocartilage, which is more of a shock absorber for our joints, such as labral or meniscal cartilage. Chondral injuries do not repair as normal cartilage because of their poor blood supply and because of the very complex architecture of this cartilage tissue, which has 4 different layers. Healing tissue tends to be more fibrocartilaginous, and it can certainly do a good enough job in the short term, but it is not ever as good as the original cartilage. Signs of cartilage injury include swelling and pain. The cartilage doesn't have a nerve supply, therefore we believe that most of the pain is related to the highly sensitive underlying bone that becomes bruised and irritated because the cartilage is no longer effectively protecting it. From a diagnostic standpoint, we can see signs of cartilage loss on X-rays when there's narrowing of the joint space between bones, where the cartilage should be, or most accurately on MRI, where we can see the actual thickness of cartilage and underlying bone bruising. Microscopic fragments of cartilage can stimulate the immune system and result in excessive production of joint fluid from the inner lining of the joint. This then results in recurrent swelling as a common symptom of cartilage injury. Bone marrow lesions are regions of disturbed blood flow and bone architecture that occur underneath areas of cartilage damage, and these are strongly linked to the development of osteoarthritis. Using the knee as an example, you can see here a progression from cartilage injury toward osteoarthritis. Once cartilage injury occurs, a chemical and inflammatory signal can continue that leads to gradual further degradation of the remaining cartilage by enzymes and mechanical forces. Bone spurs form around the joint in an attempt to spread out the surface area for loading, and this is officially osteoarthritis at this stage. Treatment. We do not have a curative agent for osteoarthritis, but we know that sticking with low impact activity, weight optimization, and regular strengthening exercise to support the joint are the most effective tools in controlling symptoms and maximizing function. Please see my lecture on osteoarthritis, where I discuss this in further detail, including adjunctive agents for osteoarthritis.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.